Okay, guys, I hope y'all enjoyed your break. We're going to pick up talking about knowledge base related to urinary elimination. I have my sweet little ninth graders in here with me, so if you hear any giggling, they're just laughing at me and me randomly talking to myself. So we're going to be talking about knowledge base. We're on slide 14. And basically, we're going to talk about infection control, growth and development, and psychosocial considerations in relation to how it affects urinary elimination. The biggest thing when it comes to urinary elimination is infection prevention and making sure we keep our patients safe by not giving them any nosocomial infections related to their urinary tract. It's important to know that the urinary tract is sterile and that it's important, even as uncomfortable as it is, to really assess the genital area every day and make sure you do pericare at least every 8 hours to ensure that our patients are staying good and clean. We've already talked about how E. coli is the #1 cause of UTIs and about how it's typically found in your poop. So it's important to keep our patients clean. Let's see. Growth and development factors really that we want to talk about. Infants and children, elderly, and those who are pregnant have the most difficulty with maintaining normal urinary status for multiple reasons. We know that loss in muscle control and sphincter control in the elderly, and also with pregnancy, when you have a 10-pound object living in your abdomen, it's going to make things difficult. Okay. Another really important thing we cannot forget about is the psychosocial considerations when it comes to urinary elimination. We all know, most of us are all young-ish, except for maybe Brenda, and it would be devastating to us if we were not able to control our urinary elimination. So it's really important to keep that in mind when we're providing care to our patients, to provide them privacy and to assure them that there's nothing to be embarrassed about. Okay, critical thinking. It's fun and exciting. It's important to really get a good grasp of the entire situation of your patient, their resources, their general assessment, what's right in front of you, but also those peripheral things, support, psychosocial considerations, mental, physical, spiritual considerations when it comes to urinary elimination. Okay, so we're moving into the nursing process and assessment. It's always so very important to think about what the needs of the patient are, what they need, what they see, how they feel. Going to the bathroom is something that's typically pretty private. And so here we are in the hospital, we're making them pee and poop in front of us, or having to change their diaper, or this may be the first time that they're having to deal with incontinence. It's a huge issue for them, for their self-image, for their function, thinking long-term, what are they going to do, how it's going to affect their life. So just always keep that in mind. And we always want to get a good nursing history. When did the problem start? How long has it been? Did you do anything different? Did you have any trauma before? Just getting a good idea of what's going on. As far as assessment, we always want to look at what involves the urinary system. The kidneys, the bladder, the external genitalia, and the perineal skin. It's so very, very, very important to make sure that we're looking at those lab values, that if they are going to the bathroom frequently, that we get a bladder scanner and we check for residual urine. If they're not going to the bathroom, we check and see how much is in their bladder, and making sure that we really stay on top of that. It's also very important if you have a male patient with a catheter, specifically if you insert it or you go to do pericare, to remember to pull that foreskin back down. It can constrict the end of the penis and cause it to swell, and it can get really uncomfortable and terrible. So don't forget to always pull that foreskin back down. Okay. Sorry, guys. I'm sure ninth graders love to hear that. Okay, so assessment of urine. They're giggling at me in their brains. It's kind of funny. As it comes to urine, it's always what you see: color, clarity, odor. Does it smell? Is it yellow? Can you see through it? It's pretty self-explanatory. If it isn't parent, if it isn't yellow, if it has an odor, something's probably up. So we want to make sure that we assess that a little bit further. Keeping good eyes and nose is so very important, specifically with your congestive heart failure patients, your renal patients, to make sure you want to be what we call even, as what you put in comes out. Being a little bit negative is okay. Being a little positive is okay, which means that you put out more than you've taken in, or you've taken in more than you put out. But when it gets to large amounts, anything over 500 cc's, negative or positive, we start to worry a little bit. Urine can range in colors from pale straw to amber. Early in the morning, it's going to be more concentrated. If you're drinking a lot of fluids during the day, it's going to be a little bit less yellow. Okay, moving on to our case study with Miss Valero. So she was able to palpate her bladder, indicating bladder distension. She has a sensation of fullness, and she still complains of dribbling frequently and being unable to urinate. Okay, so this is a great question for us to look at. A young girl is having problems urinating post-operatively. You remember that children may have trouble voiding. All of these are really true. I mean, even for adults, it's hard to urinate in a urinal or while lying in the bed just because it's not a normal, remember that muscle memory we were talking about? Just not a normal position. But for her, it's going to be a privacy thing. If you think about Maslow's hierarchy of needs and Erickson's stages of development, that kind of plays right into that. So we want to make sure that we're giving them privacy. Okay. So laboratory and diagnostic testing. There's tons of things that you can do to assess urinary elimination, function of the kidneys, the ureters, the urethra, all that good stuff. The most important thing is to know what test you're doing, why you're doing it, and any special considerations. What I tell you now about laboratory testing is going to be different when you get out of school. So it's always important to look at your laboratory policy and procedure manual and make sure you talk to the lab before you draw a specimen. The most important thing to take away from this slide is to label all specimens with the patient's name, date, time, and type of collection. As far as urine clean catch, in and out cath, if it comes from a dwelling catheter, it's important to note that. Okay, so nursing diagnosis. Risk for infection should be your primary diagnosis, that and self-care deficit and not self-esteem. What is it when you look at yourself? Your self-image. Sorry, altered self-image. So here's some nursing diagnoses related to that. Okay, planning. The biggest thing is to talk to your patient. What do they feel comfortable having you help them with? What are some goals that they feel are realistic? We can, save the world all we want to, but unless we're having and setting realistic goals with our patients, it's completely and totally pointless. Teamwork and collaboration is so important, specifically with when you think about home care, PT, OT. We want to get them up, go to the bathroom before PT, OT comes. We want to make sure that they have everything that they need at home. So it's important to focus on teamwork and collaboration. Okay, here we go. Nursing diagnosis. Urinary retention related to weakened detrusor muscle and recent removal of an indwelling catheter. This goal for Ms. Valero is going to be to have normal micturition within 1 month. Okay. Some of the goals are to avoid at least 150 mLs each time, to verbalize no episodes of dribbling or incontinence, and verbalize relief of lower abdominal comfort. For Ms. Valero, her specific case is going to need a bathroom schedule to get her body into a routine of going to the bathroom at a certain time to really make sure that she empties that bladder all the way. Okay, health promotion. Patient education is the biggest thing, how to help them maintain an appropriate self-image while they're having issues going to the bathroom. promoting normal urination. We want to make sure that they have good elimination habits. Like I said, that bathroom schedule. Also, maintaining adequate fluid intake. It's very important. They're not going to pee if they're not drinking. So we want to make sure that they do that. Again, promoting complete bladder emptying and preventing infection. It's really going to be our main focus. Okay, so here we go. So y'all think I'm not crazy. Hold on. Let's talk one more time about implementation. They've got some great notes down here as far as helping with promoting a good bladder habit and bladder schedule. Review the box 46-8 about patient teaching. It's got some great information in there for y'all. The biggest thing is specifically when they're in the hospital, when they need assistance getting to the bathroom, it's so very important to respond to requests as quickly as possible. Okay, they don't need to think that they have to go to the bathroom for an hour and a half. We need to get in there, help them get up, help them go to the bathroom, okay? To prevent going to the bathroom at night, the patient should avoid drinking fluids 2 hours before bedtime. We've already talked about how caffeine increases urine output, and how alcohol does, and other things, especially if older people are having to get up and go to the bathroom at night. Okay, time voiding is voiding according to a clock, not the urge, and is a helpful strategy when the bladder doesn't fully empty. So again, that toileting schedule, that bathroom schedule can be very helpful. Nurses play a key role in implementing these evidence-based interventions and staying focused on adequate fluid intake, perineal hygiene, and voiding at regular intervals. Okay, so here's our case study again. Interventions for urinary retention and care include, we've already talked about getting our patient up to go to the bathroom every 2 to 3 hours. They can do that at home. It's a great way, again, to completely empty that bladder, to inhibit the dribbling and different things like that. If you're really trying to get on a good schedule or you're wanting some more information, get your patient or family to record urinary output. They can use a Nuns cap that was shown in a previous slide. It's a great way to measure output. A warm bath is a great way to stimulate that need to go to the bathroom. And also the Crede method is a great way to help empty that bladder all the way. And that's just where you just get the patient to put their hand right over their bladder and just kind of mash and use that pressure to finish emptying the bladder. Okay, so here's some great acute care, different types of catheters. You have your straight drainage cap that you're going to use for just a straight in and out. You've got, this is a great one, just an indwelling catheter that you see that has 2 lumens. You have the balloon, and then you have the urine drainage, and here's your balloon right here. And then this one is going to be your triple lumen catheter. This is really good for patients who have like a cystoscopy or something like that in the bladder, where they're wanting to make sure that they're getting all the blood out and they're not having any blood clots or anything like that. One side, the irrigation solution flows in, and then it flows out the other side. Okay, so catheter sizes, again, it's going to depend on your patient. If your patient is big, they need a bigger catheter. If they're smaller, they need a smaller one. Most adults use a 14 to 16 French, a 5 to 6 French for infants, 8 to 10 for children, and then for young girls, a 12 French. And each balloon that keeps the catheter in place is going to be a different size. So always look. Right here, it'll tell you it's a 20 French and it's got a 30 cc balloon in there. So it's going to tell you how big it is and how much fluid you should put in your balloon. Okay. This is just talking about drainage systems. And so, again, what is your number one nursing diagnosis going to be for a patient with a catheter in place or in and out catheterization? Okay, infection prevention is so very, very important. What's the most common form of bacteria that causes UTIs? Tamaria. Okay, E. coli. Good job. So it's really important to make sure that we're doing great peri-care, okay? Catheterization, drainage systems, again, what we use today may not be what you use when you get out of school in 2 years. But it's always important to be familiar with what system you're using and how to empty it, how to collect specimens from it, and different things like that. Those may differ from hospital to hospital, so be sure that you're looking at those, okay? Again, patients with indwelling catheters require regular peri-hygiene, especially after a bowel movement, to reduce the risk of catheter-associated UTIs. I'm not sure if y'all heard a lot about reimbursement for care and hospital-acquired conditions and different things like that. But hospitals are not reimbursed for catheter-associated UTIs. They lose lots of money every year because they're paying for high-dose, high-dollar antibiotics to treat these catheter-associated UTIs that the Centers for Medicaid and Medicare and the Joint Commission and other insurance agencies feel that we can prevent. So it's important to do great peri-care. Okay, it's important to look and assess that drainage in your bag. You want that catheter to be draining consistently small amounts of urine. If it's not, it could be that it is kinked or clamped. It's important if your patient complains of pressure in their bladder or in their lower abdomen that you look and make sure that the catheter is not pulled too taut with that balloon sitting against that sphincter, or that the catheter is not kinked. Okay, so here's what a female catheter looks like. You can see the rectum and entrance to the vagina, and there's your urethra. Okay. Let's see what we've got going on. Prompt removal of indwelling catheters when it's not needed is really, really important. If you have a patient in the ICUs, they're the worst about leaving a patient with a indwelling catheter when they don't really need it, just because it's easier when a patient has a catheter because you're not having to change a diaper every 2 hours on a big, heavy patient. But remember, we want to think about what's best for the patient, not what's best for us. So it's important to remove those catheters as soon as we can. If we're not worried about urine output and we can easily get that by weighing a diaper, that's what we need to do. Okay. It's also important to let our patients know that after we remove a catheter, they may experience a little bit of discomfort when they're voiding for the first 2 or 3 times, just because that urethra has been irritated with that catheter. And that's normal, but continued pain should be noted and continued discomfort to assess for a possible UTI. Okay, so when it comes to urinary diversions, again, it's so very important to know what your policy and practice standards are at the hospital that you're working at. You need to know who's going to be doing those, if that's your responsibility, if that is the nephrology nurse, if that's the urology nurse, whoever's responsibility that is, we need to make sure that we know who that is. Okay. Okay, here's a list of some medications that are common for patients with urinary elimination issues. Just take a look over those and be familiar with those. Also know that some of these medications can change the color of your urine. Some of it can even turn it blue, which is really, really freaky, especially if you're not expecting it. Okay, implementation. Again, it's so important to look at lifestyle changes and how it's going to affect the patient. And we need to talk about self-care deficit. We need to talk about self-image. It's also important to always remember good peri-care and skin assessment. If we have a patient that's voiding in a diaper, we want to make sure that they are good and clean each and every time that we take that diaper off. Okay. Okay, here it is, the good information I'm going to take all. It's important to teach patients about food and fluids that cause bladder irritation and increase symptoms such as frequency, urgency, and incontinence. Common irritants are artificial sweeteners, spicy foods, and citrus products, as well as caffeine. Okay, sorry, I disappeared. Okay, there we go. So artificial sweeteners, spicy foods, citrus products, and caffeine. Now I know why I go to the bathroom all the time. I eat all of these. It's pretty sad. Okay, and then also one other thing we want to talk about is pelvic floor muscle training, and that's what we call the Kegel maneuvers or the Kegel exercises. It's specifically important for women as they get older because they lose that pelvic floor strength, and it can help decrease their risk of stress incontinence. And it's simply where they just squeeze those muscles. Let's see what the official term is. The pelvic floor muscles. Okay, it's not the Kegel, but it's the Kegel. And they need to just squeeze those muscles, just like they would if they're trying to stop going to the bathroom, like midstream. Those muscles that they use to stop going to the bathroom are great ways to help increase that pelvic floor muscle strength. Okay, so here we go. There's a great picture right here. Women have really long and lean pelvic floor muscles. Men have shorter, more, I guess bigger would be the best word to say, pelvic floor muscles. Okay, evaluation, again, through the patient's eyes. Assess their self-image, social interactions, their sexuality, and their emotional status. Okay. Again, so very important to look at their self-image and social interactions. Not being able to control going to the bathroom is a huge thing for people. It will be a huge thing for you. It will be a huge thing for me. So it's really important to assess that and assure them that it happens to more people. It's not just them. Okay, now we're back to Miss Valero. Sandy talks with Miss Valero the next evening. The patient's care plan incorporates scheduled voiding, oral fluids, and use of the Credé method for manual compression during voiding. She palpates Miss Valero's bladder and assists her to the toilet. After making sure she's comfortable and leaving the call light in place, Sandy instructs her to use the Credé method of manual compression. She returns to measure Miss Valero's urinary output and evaluates for bladder residual using an ultrasound bladder scanner. Ultrasound bladder scanners are a great way to make sure that your patients are voiding, they're emptying their bladder. If they feel that fullness and urgency, checking to see how much volume is in their bladder before we do in and out cath. Okay. We want to, again, continue to ask about her urge to void, bladder fullness, and if her dribbling episodes have gotten any better, which they should with the scheduled voiding that we're doing. We want her to keep a log over a 1 month period so that we can monitor improvement with her plans for her interventions. Okay. People are going to always be concerned about whether or not they're going to regain control over their urinary elimination, and it's always important to reassure them that it may or may not. There are other methods to take care of that. There are stimulators and pacers that can be surgically inserted to help with that. We want to make sure that we do really good patient education, make sure that they can verbalize what we're telling them, that they know what the Credé method is, they know to keep a log, they know to go to the bathroom every 3 hours, because we can talk all day, but unless our patients understand what we're saying, it's completely and totally pointless. Okay, safety guidelines. Gotta love some safety guidelines. Again, our biggest thing is going to be staying focused on decreasing the risk for infection. Bladder infections and UTIs can get out of control and cause a patient to get septic quickly, specifically if they're immunocompromised. It's so important for us to teach great pericare, to make sure it gets done in the hospital, that it gets done at home, that patients aren't sitting in a wet diaper with pee and poop in it, and that we're being really good care providers for them. Um, Again, identify risk for patients with a latex allergy. That's always important and should be done upon admission to the hospital. Most hospitals are all latex free though. Identify patients with allergies to iodine or betadine. That's really important specifically if they're going to be doing in and out caths or have an indwelling catheter, because that's the cleaning method that we use before insertion. Okay, so y'all can thank my sweet clinical group who I just love and adore. Give a shout out to them for being so awesome this weekend, being flexible, looking for work to do. We were beast when it came to taking care of that call light and getting folks up to the bathroom. So kudos to my clinical group. Let's see if I can remember all their names. Just kidding. Brenda, Kaylin, Ty, Tamaria, Priska, Carl, and Demaje. Did I say it right? I hope I did. Anyway, they did a great job this weekend and worked really hard. And I really hate that all of y'all are missing out on our great experiences on Saturdays. Told y'all you should have been in my clinical group. Okay, are you smarter than a fifth grader? So there's just 10 questions that we're going to go over super quick. We're going to talk about why each answer is the way that it is. Okay, that was per their request to understand kind of how to think through test questions. A nurse is teaching a patient about the urinary system. In which order will the nurse present the structure following the flow of urine? Okay, so you should have your little form that Dr. Welch gave you that has A, B, C, or D on it. I want you to stick it up in the air. We're going to be making sure that everybody responds, because test questions and group work are no fun if not everybody takes part. So take just a second to look at that and tell me and hold up your answer. Okay, so the flow of urine, that correct answer is B, okay, because you want to follow the flow of urine when you're doing teaching. Kidneys, ureters, bladder, and urethra, okay? The ureters and urethra are different, and they're both funny to say. Okay, a patient is experiencing oliguria. Which action should the nurse perform first? Okay, the important part for this question is knowing what oliguria is. Okay, remember that word wall? Get you a piece of paper out, write down the words that you don't know what they are, because it's really important, specifically when you're talking with physicians and reading books, that you know the real fancy names for stuff. When we're talking to our patients, we can use normal language, but professional communication, it's good to not say pee and poop. Okay, guys, so the answer is going to be A. Oliguria is diminished urinary output in relation to fluid intake. So it means that the patient's retaining urine. So it doesn't matter if we're going to order diuretics. That's not going to help. If we increase the patient's IV fluid rate, it's just going to make it worse. And encouraging the patient to drink caffeinated beverages, again, it's just going to make it worse, because oliguria is diminished urinary output in relation to fluid intake. Okay, let's see what it says. Okay, so it could be that the patient does not have adequate intake. So we don't want to, sorry, I'm reading. I don't have it on the slides. Okay. For oliguria, basically we want to make sure that they've got adequate PO intake. It could be that the bladder sphincter is not functioning and the patient is retaining water. That's why you want to check for bladder distension first. Okay. If they're not drinking enough, diuretics isn't really going to be beneficial. IV fluids is important, but we want to make sure that they're not retaining fluids first. Okay. A A patient requests the nurse help to the bedside commode and becomes frustrated when unable to void in front of the nurse. How should the nurse interpret the patient's ability to avoid? Okay, so this is your first interaction with this patient. The first thing that you're going to want to do is give them some privacy. So the correct answer is A. Being able to avoid in front of another person can make the patient anxious, so we want to give them some privacy. Make sure they don't fall, but give them some privacy. If it becomes something that's common, that happens a lot, even with giving the patient privacy, you can start assessing some of those other things. If it's a psychological need, if it's a physiological issue as far as not being able for the body to understand that muscle memory, and checking to make sure that the patient's drinking enough. Okay. A patient has fallen several times in the past week when attempting to get to the bathroom. The patient gets up 3 or 4 times a night to urinate. Which recommendation by the nurse is most appropriate in correcting the urinary problem? Okay, so all of these answers are right, but it's the question of which is the most right answer. Okay, so we want to make sure we look at the question. What is the most appropriate in correcting the urinary problem? Okay, if we're wanting to help the patient not void at night, we're going to do A. We're going to tell them to limit fluid intake and caffeine 2 hours before bed. Okay. We also want to tell them to leave the light on so that they don't fall. We want them to practice those Kegel exercises because that's beneficial for everybody. We want to make sure we have a clear path to the bathroom to prevent them from falling. But if we're looking at correcting the urinary problem, we're going to limit that fluid and caffeine intake. Okay. Upon palpation, the nurse notices that the bladder is firm and distended. The patient expresses an urge to urinate. Which question is most appropriate? Okay, the most appropriate answer is going to be C. When was the last time you voided? Okay, it's important to obtain an accurate assessment. Urinary retention causes the bladder to be firm and distended. Knowing when they voided last is very important. If they're having trouble voiding, then we can assess other things to do, okay? Such as, does it interfere with your activities? Those are answers more down the line, okay? The most appropriate initial intervention is to ask when the last time was that you voided. Okay? A nurse is inserting a catheter into a female patient. When the nurse inserts the catheter, no urine is obtained. The nurse suspects the catheter is not in the urethra. What should the nurse do? They're going to video me. They're going to watch me. Sounds miserable. Okay, guys. So this is a great thing to do in real life, which is why I picked this question. The correct answer is D. Leave the catheter in the vagina as a landmark for insertion of a new sterile catheter. I say putting in a catheter on a female is probably one of the most difficult things, specifically if you don't have good help to see. Women are multiple choice, A, B, and C, and guys just have 2 choices, A and B. So A, B, and C is a lot more difficult than A and B. So if no urine appears, leave that catheter there and know that you have to go above it to get into the urethra. You definitely don't want to take it out and clean it with alcohol and reinsert it because that's just gross. That is not a good infection prevention technique. We already know that the urinary tract is sterile. The vagina is not sterile, and alcohol is not going to get rid of all those germs. Okay. A patient asked about treatment for stress urinary incontinence. Which is the nurse's best response? Okay, the correct answer for this question is A. Perform pelvic floor exercises. Do those Kegels. That's the best way to decrease that stress incontinence. Avoiding frequently is just completely and totally contrary to what is a good habit. Drinking cranberry juice, is good, but it's not going to help with that. And wearing an adult diaper has so many self-image issues and risk of infection. That's not a good decision for this question. Okay, so this is this is going to be a question that you may not know the answer to, but be sure that you look at the speaker notes for this slide because it's got some great information. A nurse is reviewing results for a urine specimen. What will the nurse expect to see in a patient with a urinary tract infection? Okay, the correct answer is D, bacteria. Bacteria in the urine, along with other symptoms, supports the diagnosis of a UTI. Crystals would be seen with the renal stone formation. Cast would indicate renal disease. Protein indicates kidney function and damage to the glomerular membrane, such as glomerulonephritis. So it's important to look at those lab results and know what you expect and what each result signals as far as the next intervention or treatment option. Okay, guys, that's it for me today. I'm going to be working on doing some things a little different for our next lecture, so you're not just stuck listening to me for an hour and a half. Be sure if you have any ideas or thoughts about how to make my lectures better, since I'm not right there with y'all, please let me know. I'm open to feedback and how to make it the most beneficial to y'all. But I hope you'll have a great day, and I'll see my clinical group on Saturday, and I'll see y'all again next week. Bye, guys.